We currently license the ambulatory, inpatient surgical care, general recovery guidelines, behavioral health, and multi-conditioned module. But then we also have other Medi-Cal guidelines. We have coverage benefits that we look at. But our first level of review is applied to the MCG. I really like the fact that not only does it give you, step by step walking through the guidelines, but also the benchmarks that are available with them as well. Our organization has become very data-driven and analytical-driven, and so having those benchmarks and being able to apply them to not only our organization, but comparing ourselves against others similar to us is very important to our leadership. The inpatient surgical guidelines have really helped us streamline moving our providers away from admissions and looking more towards observation. And one of the challenges we had before that was because our hospitals would not contract with us for observation. So most of our 1 and 2 day stays probably would have qualified for observation if we had that in our contract. So now we're looking at cost savings, consistency across the guideline application, and the IRR that's part of that licensure that we have helps us to train our staff, to onboard our new staff, and make sure that they're making consistent and across-the-board evidence-based decisions for medical necessity. Our inpatient nurses really like the variance application on that because we know that there is no cookie-cutter admission. Everybody may come in with the same diagnosis, but depending on their comorbidities, their recovery period, the treatments that they're receiving, their response to the treatments, variance days are inevitable. But having that consistency with the application of the MCG allows us to make sure that our nurses are making good decisions and having good conversations with our doctors and hospitalists to make sure that we're driving the patient to the right level of care at the right time.